Dr. Hillary Kunis from New York City Department of Health is going to be following you guys up. Go ahead.
Even the presentation that you put in the stats that both the chief and yourself made reference to, it's eye-opening, it's astonishing. And there's not too many people in the communities at large who really see this on a day-to-day basis. The press is not picking it up. They're not running with it. Every now and then, if there is a big bust, yeah, it'll make the news, the headlines, but you know, maybe they're reading about an overdose in the obituary, and that's about it. But whether it's gun violence in the streets of New York City or any part of the state of New York, it's probably associated with the narcotic side. And that one image that you had with the chief that you showed with the police officers being shot, and then finding out just days later or a day after that, look at this giant find of one of the largest, seizing the largest amount of heroin ready to go to the streets. We need to see more of that. And I know it's not your issue to solve and put it in the public, but the press need to engage more in the conversation to show that this crisis that we have, people are dying. And the amount of heroin being distributed in this supply is not going to go away, and it's very cheap. So we have to do everything we can to educate and to make them all aware. They don't need to go, they don't want to go and touch this stuff. They shouldn't go and touch this stuff, and we're going to come after you, and we're going to come after you hard.
If I can, I got two more questions, and I'd like to, if the audience has a question for this panel, there is a microphone that's walking around, so please try not to be repetitive if you can. If it's already been asked and answered, please, because of the time and other people are going to testify before us, to give them the opportunity. But you pointed out to us the number of how they start with cocaine being the next the drug before the heroin. I had Dynamite here, Dynamite Youth. I did one of these over at 250 Broadway. I see Bill Fusco and Karen here, and I see some of the kids from the program. But there was maybe 16 to 18 kids, and I asked them, well, how did you get started? And I think two of them started off with beer and you know, the natural progression, marijuana, and then a lot of them to the cocaine. But there were two of them, kids that were in that audience that started off with actual painkillers from injuries from sports from high school that got them addicted to it. And luckily we do have this one location. We have many other providers here today that may talk in a little while, but I don't think they're listening to you. Are there enough beds, enough programs, enough detoxes to be able to, I understand you can't get a person into detox, that they're all full. Are you having the same, do you hear the same stuff out there in the street? Or you wouldn't hear that?
We work with treatment providers quite a bit. They're great partners and great collaborators. And we hear about a shortage of certain kinds of beds. Detox is often an issue. And then there's a real shortage of beds for young people, especially under the age of 18. I mean, the treatment providers, of course, excuse me, would be the best ones to ask about that.
That could be insurance issues or whatever. Is that? Yeah,
that's what I hear, but again, they'll be the experts.
You know, when I was growing up, the big thing back then it was heroin back in the 70s, and I am that old. But you'd see the needle on the street. You'd never think about going near a needle. Today, the kids have a different mindset. The natural progression from sniffing it, snorting it, smoking it, is now to the next high, is to the final high, is to shooting it. And the kids seem to have no problem in picking up that needle and shooting it. I am, for the life of me, and I'm talking about middle-class America. I'm talking right across the board here. I'm amazed at how many people are out there doing needles. Are you seeing a lot of needles as well in your arrest?
We don't see the
Pull the mic closer, please, Ted.
We don't see the increase in needles, like I was saying earlier. It's the crushing of pills. Any way to get it into the bloodstream without a needle, they'll go to the extreme of even cutting themselves and rubbing it into the wound. and it'll make its way through the bloodstream that way. The access to needles, may not be a good avenue to go. So they go that way, or they're much more sniffing it. A cleaner way for also to prevent detection from parents and guardians.
To your point, that's why we're seeing the rise in Hep C.
Hep C.
Yeah. So, Bridget, just so you have an idea of what we're working on, this task force is expanding the crime of operating as a major trafficker. It's Bill S-4177, sponsored by myself and, of course, Senator Amador and the task force team. And basically, instead of the traffickers, quote-unquote, major traffickers having to act as with 4 people, we're reducing it to 3. And if instead of it having to be over $75,000 within a 12-month period, we're going to take it down to $25,000. So you can have some teeth when you actually get into these guys.
And Senator Golden.
Of course. I said you're part of the task force team, right?
The last 2 things, you have a breakdown of the body count here in the city. If you could give me that body count and broken down by borough, if you can, I'd
And
like
I think
that.
Hillary, when she testifies, will have that information. It's in some of their EPI reports, which are online.
And then I'm going to ask my colleagues if they have any other comments, and then we're going to go to the audience. But the last thing I'm going to throw in here is uniform. We have a number of uniform. We've seen the largest hire in years, in the past year and a half, 2 years, which I commend our police commissioner, and I commend the job that NYPD is doing. And obviously, with our special narcotics prosecutor, the work that you're doing is outstanding. But I will tell you, there's still not enough uniform. If I were to look at the uniform count in the 6-8 precinct for one, I will tell you the count that was there 10 years ago, 15 years ago, the count that was there 5 years ago was higher than it is today. You can't manage a precinct if they don't have the bodies in the precinct to be able to manage the streets, and we need more uniform cops in our precincts. So I got to tell you right now, if you were to take a look at the count on the 6-8 precinct alone, what the number of police officers, 90 police officers in a precinct of this size, it's absurd. We need more bodies. So if you could bring that message back, if somebody could take a look at the numbers in Brooklyn South as to the uniform presence in our commands, we'd appreciate it. 6-8 has really undermanned when it comes to the number of uniformed officers, and we need more uniformed officers here in the 6-8 precinct and across the board in Brooklyn South. Ladies and gentlemen, my colleagues, you have anything else?
I just want to thank you for all your hard work and what you're doing, and keep it up. And you know that you have a partner in the legislature to try to help.
One last quick question. I'm not sure if you have any statistic on this. Someone had told me that all heroin comes through New York City, roughly around close to 40% of it in the United States is coming through here. I'm not sure if that's true or not.
The DEA has put out statistics on that. I don't have them on the top of my head, but I could get that for you.
No sweat. I heard that. It was staggering
Yeah.
that basically it's flooding right through here. It's incredible.
John Quaglione, did anybody in the audience have a question? Right over here. Thank you, James. Please state your name, please, and what you represent, and go ahead.
Dr. Lance Austin. I'm a resident of Staten Island. I'm a treatment provider in Sheepshead Bay, Brooklyn. You talked about the level of cut in the heroin, but you didn't mention anything about the most lethal form of heroin, the one that's cut with fentanyl. So can you comment on the fentanyl cut
Michael
heroin
Jackson.
and the lethal heroin?
The police laboratory tests for fentanyl and all heroin, and when we discover that is in a package, we do follow up on the person that was arrested, as well as any additional follow up we can do as to where he or she gets it from. In the symposiums that I discussed that were arranged targeting and discussing the problem in the Northeast of the United States, that problem was really of greater concern and of greater infiltration in the public and within the drugs in other jurisdictions. In New York City, we've seen it, and there are cases that I have in mind at this very moment that involve it, but the problem was that was predominantly in other jurisdictions where it was either part of lacing with heroin or where it was in and of itself just distributed. And if the Special Narcotics Prosecutor has anything different, please feel free.
I just want to amplify that. We have seized kilos of fentanyl in mills, but we are not recovering it mixed in with the heroin very often in New York City. It's often recovered in Pennsylvania, in the Buffalo area, in different areas, but we haven't seen it so much here in the city, although, as I say, we're the producer that is supplying much of the region. And so we have seized raw fentanyl.
I believe in Erie County, they had 23 deaths in 11 days, and it was cut with fentanyl.
What's fentanyl?
James, if you...
It's used in anesthesia.
It's
It's
an
in the-
opiate, basically, and when you look at it, the best way to describe it is
It suppresses
the best way to describe it is it's another similarity, to heroin in that same family, and like any almost any drink, any drug, the different mixture may affect different people differently. So I think a lot of times the surprise of having that injected into your system, however it is injected into your system, whether it's snort, needle injection, smoking, it is a shock to the previous type of narcotic that was being used, which contributes to the effect from the conferrals that I've made.
Sir, what it is, I have a little bit of knowledge in this. Basically, your central nervous system has a sympathetic nervous system, which is for fight or flight, and a parasympathetic nervous system, which is to wine and dine. The fentanyl overstimulates your parasympathetic nervous system, so when the phrenic nerve that innervates the diaphragm, it goes to sleep. Same with the opioid. And so basically what you're seeing is that these people are really stopping breathing. And that's why this naloxone, when you hit them, within 30 seconds, they literally come back to life. Because it neutralizes every opioid in your body, and what happens is you go boom, and they didn't even know they were sleeping, nonetheless dead, and they come back and are actually very violent. So what it does is the fentanyl overstimulates your parasympathetic nervous system, which puts you to sleep.
And how easy is that to use, and why should that be in everybody's household?
This is completely benign. If you don't know that someone is having either a seizure and they're out, or they're having an opioid overdose, if you hit them, and this kit could be put together within 30 seconds, it's a nasal spray, intramucal, so you spray it into the nose, There's two things in here, there's a few milligrams, and if they're not having an opioid overdose, the worst thing that's going to happen is they're going to get a little drip come out of their nose.
Very life-saving. Any other questions from the audience? We got to move on. Go ahead, right here, James.
I just had 2 points I wanted to bring up. One was the accessibility to needles. I know for a fact kids can go to any local pharmacy and get a certain amount of needles without a prescription. And I wonder why that is, that it's not demanded a prescription. There's no need for a teenager, a 20-year-old to walk into any pharmacy and pick up a bag of needles.
Okay, Bridget will handle that question first. Stay there. I'm going to answer your next question second. Go ahead, Bridget. Use the mic.
The law was changed probably about 15 years ago, which allowed the dispensing of a certain number of hypodermic needles without a prescription. It was to reduce the spread of AIDS, really.
In light of the epidemic we have now, I think that should be considered changing that law, honestly.
It's not a bad idea.
Yeah, and the second
It's a good thing to look at.
The second point I want to bring up is the discussion about your quote-unquote kingpin dealers. My
Mic
son,
closer to your mouth, please. The mic closer to your mouth.
I'm sorry, the kingpin dealers that you're zeroing in. I understand where you're coming from with that, but my son, your daughter, they're not dealing with the kingpin. They're dealing with the boy down the block that's been dealing for 5 years. I know the same kids over and over that are dealing. They're not getting in trouble. My kid's life is on the line. I have to tell you, I'm beyond frustrated, disgusted that the same kids for years are still dealing, whether they're low level or not. That's who my kid is dealing with, not, the kingpin. So I want to know why we can't, knuckle down on these neighborhood kids that are dealing for years. Because I personally can walk you to homes, bagel shops in my neighborhood where I know they've been dealing for years and nothing has been done, and I have spoken to detectives about that.
Chief?
I sympathize with what you're saying. I'm a parent and a lifelong city resident. What I was doing, I was outlining some of our approaches and some of the units I'm responsible for, but the overwhelming dedication of manpower is to the type of problem you're describing. And, there are better detectives than others. I tend to think that all of the people that work for me are good, but I think we all know that there's people who are better at their job than others. If you reported it and it previously was unsuccessful, I ask that you give me the opportunity to try again, and I'll speak to you on the side afterward and take your information and do my best for you.
Thank you very much, Chief. You had a backup question? Is that your second question? Yes? Okay, any other questions?
Thank you.
No other questions for the audience. Listen, ladies and gentlemen, give this panel a round of applause. Thank you very much. More uniforms. You're going to deal with the issue on the pain management locations, and we'll talk about that. Ladies and gentlemen, if you can take your seats, we're ready to proceed with the next panel. Ladies and gentlemen, we have present with us today the testimony here of Hillary Cunnis, a doctor. She is the Assistant Commissioner at the Bureau of Alcohol and Drug Use Prevention, Treatment Center and Care. She works for the New York City Department of Health and Mental Hygiene. She is here before the task force, as well as Stephanie Campbell, Friends of Recovery, will also be sitting at the same panel. So we're going to start with the testimony of Dr. Cunnis.
Good afternoon. Can you hear me?
Yes,
Okay.
put a little closer to you.
Good afternoon, Chairpersons Murphy, Amador Ort, members of the task force, and thank you very much, Senator Golden, for inviting us here today. As you heard, I'm Dr. Hillary Cunnis. I'm an Assistant Commissioner at the New York City Department of Health and Mental Hygiene, where I head up the Bureau of Alcohol and Drug Use Prevention, Care, and Treatment. On behalf of Commissioner Mary Bassett, I thank you for your continued commitment and leadership on this very important issue. As I think we've heard this afternoon, New York City, along with many other jurisdictions, is in the midst of a drug overdose epidemic. And also, as you heard, rates of opioid overdose outpace murders in our city and outpace fatal car crashes. These overdose deaths are largely driven by heroin and opioid analgesics or prescription painkillers, resulting in more than 2 deaths each day in New York City. In the last decade, opioid overdoses have claimed the lives of more than 7,000 individuals in New York City. And as we know, also, these deaths represent just the most severe aspect of the epidemic, and many, many more individuals experience non-fatal overdose and struggle with substance use disorders and related health problems that impair their function and well-being. In 2014, opioids were involved in 79% of all overdose deaths in New York City. And the rates of overdose deaths involving opioid analgesics increased by 256% from 2000 to 2014. And this took place, as you've been hearing, particularly among residents of low-poverty neighborhoods or wealthier neighborhoods. Since 2010, we have seen rates of heroin-involved overdose deaths dramatically increase in the city, both among residents of high poverty and low poverty areas. And you saw the map from the City Health Department that the Special Narcotics Prosecutor showed. And I'll just add to my testimony that we saw heroin deaths increase in New York City prior to I-STOP implementation, so that predates the I-STOP. At the City Health Department, we've taken a multi-pronged approach to addressing the problem of overdose deaths. We've included prescriber education and public awareness campaigns. And we know that these deaths are preventable also with treatment and a variety of prevention efforts. Today, I wanted to just focus on 2 areas that I thought it would be helpful for the task force to know about. These are critical gaps in services that can reduce mortality and promote the health of people with addiction. And I want to address specifically medication-assisted treatment and harm reduction services. We know that medication-assisted treatment for opioid addiction, particularly using methadone and buprenorphine, has been proven in multiple scientific studies to reduce mortality, reduce drug use, reduce crime, and save lives. We estimate that between 15,000 and 30,000 people currently not in treatment could benefit from treatment services. The department funds and oversees drug treatment services in collaboration with the New York State Office of Alcoholism and Drug Abuse Services. And as part of those services, medication-assisted treatment is one very effective strategy for reducing opioid mortality, and methadone clinics are a vital city service. I want to now share with you some new work that we are just beginning, a buprenorphine prescribing initiative. Buprenorphine is another effective medication for the treatment of opioid addiction. And through this initiative, we will train 330 primary care physicians annually for the next year. And we are also offering new financial support through a nurse care manager model for additional primary care sites. Addressing opioid addiction in primary care settings has an important benefit in which stigma that sometimes is accompanied by attending a drug treatment program does not affect the person who's getting care more privately through a primary care practice. Know, however, that access to buprenorphine is highly regulated by federal prescribing requirements. We are supporting and encourage you to support the Recovery Enhancement for Addiction Treatment, or TREAT Act, that is currently pending before Congress. This act would relax patient limits and allow nurse practitioners and physician assistants who receive specialized training to prescribe buprenorphine under the supervision of a qualified physician. I'll just add that at present in New York State, both nurse practitioners and physician assistants can prescribe opioid painkillers without any special regulation. Medication-assisted treatment, however, may not be the appropriate approach for all New Yorkers with an opioid addiction, and you'll be hearing from colleagues in the field about other treatment approaches in New York City. I also, though, want to mention something that doesn't often get talked about in this setting, which is harm reduction services. And as we heard from a woman who asked the question, sometimes it's bewildering to ask people who may not be ready to stop using drugs or to offer them other kinds of life-saving services. So we wanted to highlight the important work of New York City's syringe exchange programs, of which there are 14. These syringe exchange programs are known for providing sterile syringes to people, but they importantly engage and link people who are actively using drugs and may not be ready to stop using in a range of health-promoting care and services, including testing and care for HIV, hepatitis B and C. Peer-delivered syringe exchange, which has become a key component of harm reduction, has been particularly affecting people who are out of care and most in need. Our syringe exchange programs in New York City have been early leaders in training community members in overdose prevention and naloxone administration, which is now, as you've been hearing, a widely touted approach to reducing overdose deaths. The City Health Department has been distributing naloxone since 2009. As you've heard, naloxone is a safe medication that reverses an opioid overdose, restores a person's breathing. We distribute this naloxone through 40 community-based programs, including to the syringe exchange programs, as well as many other agencies. For the first time this year, the city has allocated a dedicated budget for naloxone distribution, and in the upcoming fiscal year, this will include $750,000 to expand distribution. We have partnered at the health department with multiple other city agencies to distribute naloxone, and you heard already from my colleague at the New York Police Department. We've also partnered with the Department of Homeless Services, Correctional Health Services, and the Administration of Children's Services to ensure naloxone is as widely available as possible. We are seeking new partners and new ways to distribute naloxone, and we in particular encourage physicians, other primary care providers, other community organizations to register with the New York State Department of Health to become opioid overdose prevention programs, and then can be permitted to train community members to recognize overdose and distribute naloxone. Finally, I want to mention our new pharmacy initiative in collaboration with our partners at the State Health Department. Through a standing order from the New York City Health Commissioner and through other standing orders in chain pharmacies, naloxone is available in more than 660 New York City pharmacies, including most Rite Aid stores, all CVS, and all Duane Reade and Walgreens stores. And we encourage people who use drugs, their loved ones, family members, to visit participating pharmacies to keep this life-saving medication on hand in case of overdose. We, in addition to treatment and harm reduction services, which are part of the department's comprehensive public health approach to the epidemic, we have also actively promoted our what we call judicious opioid analgesic prescribing guidelines, working to educate prescribers to prescribe more carefully in order to reduce exposure to opioids by people who could possibly become addicted. We also conduct surveillance, and you saw from the Special Narcotics Prosecutor several of our maps, and I'll make additional epi data briefs that we have online that detail the specific counts that I think would be helpful to the task force. The last thing I just want to mention is, as it's been mentioned, and I'll say it again, it's important to note that there is still such tremendous stigma associated with drug use, and particularly around the illegality of drugs. And this stigma is profound. It affects individuals' willingness to disclose their drug use and to seek help. And it creates barriers to being able to convey public health-based harm reduction messages to populations most at risk in order to keep them safe and alive, in order to get better. Finally, drug treatment itself of all kinds, and in particular methadone treatment, is highly stigmatized. We ask that you continue to pursue legislation that expands access to both medication-assisted treatment and harm reduction, as well as the full array of drug treatment services. If we are to continue to develop innovative, collaborative, effective interventions, it's imperative we all engage in open conversations about the long-term needs of people who use drugs in our communities. Thank you for your time, and I'm happy to answer any questions.
Did you want? I got to tell you, excellent. And there's going to be a lot of questions, obviously, that people want to ask, especially when it comes to the syringe issue and some other issues. But we not only have families and people that want to keep it quiet. We have communities that don't want people to know. We have religious communities, families. They don't want the next door neighbor or the synagogue or the mosque or the church family to know what's going on. And when you have large communities that keep it a secret, that's where we seem to have the most problems. And hopefully, I use my office as one of them. If you feel you cannot get that help, or you feel that you would be people in the community would know that you have a problem or the family has a problem, I ask them to come to my office and we will get them the help that they need, and nobody on the block and nobody in the community will know that you have a drug issue. But when you have large communities that are insular and keep their kids and their families away from coming to for help, whether it be through doctors or through the police departments or through appropriate treatment programs, that only enhances the drug in that community and enhances the life and death scenarios that we see in our communities across our city. I just wanted to point that out, and I did that for a reason, because I want people to understand it's not just the family, it's not just the individual, but it's communities of faith that are not coming forward and letting us know because they're afraid their faith communities will find out about it. We need those people to get the help that they need to stay alive and to reunite those families. So please, you need help, come my office, any place. Please get the help you need. Gentlemen?